Welcome, everyone, to the podcast today. We are here with Dr. Tanya Miller, who is the owner of TYM Coaching, and Cindy Kraft, who is the owner founder of K&K Healthcare Solutions. I'm Sherry Teague. I'm one of the other owners and founders of K&K Healthcare Solutions. And what we're here to talk about is the aspect of leading change. We have the OASIS E coming up January 1st, 2023, and many of you are in a scramble mode trying to get your education, trying to get your staff on board. And, honestly, a little fearful of what's going to happen January 1st when this new letter change in the OASIS occurs. So we wanted to create a series of podcasts that would help you manage that change and lead that change in a very positive way. Our first one is on accountability. Cindy, would you like to start our chat?
I'd be happy to, Sherry. This series came about out of kind of looking at the bigger picture around OASIS management. And this is not our first OASIS. This is not the first time we've seen a substantive change where it moved from one letter to the next. But I think what I'm noticing, especially as we get closer to the start date, is we're kind of going back to tried and true ways of preparation. And overwhelmingly, those are about educating staff. And K&K does a lot of work in that space, helping to get staff, both the clinicians and review staff, ready with that kind of information. But as I'm putting that content together, it struck me that if education by itself was perfectly effective in preparing people, then our current OASIS should really be error-free. I mean, that OASIS related to the PHE got delayed in terms of any substantive changes for an extended period of time. So with the same questions in place, with the same guidance basically in place, how are we still seeing so much back and forth between the reviewer and the clinician about getting to a clean OASIS? And I think sometimes what I hear a lot of, well, it's always the clinician's fault. The clinician just needs to understand better. I agree, they do need to have the right tools and resources to collect accurate data, but I'm beginning to wonder if there's more of a back office leadership element to this than we're really paying attention to, which when I think anything about leadership, I immediately thought of Tanya and reached out to Tanya and said, wait a minute, do you see an intersection between what you do in the Leadership Academy and what's going on with OASIS education? Because I think there's a disconnect. And Tanya, I think one of the first words that came out of your mouth was the topic of this particular podcast, which is accountability. So where do you see that intersection? Because I feel sometimes like I'm beating my head against the wall, and I'm sure agency leaders do as well, with I just keep repeating and repeating what I've done, and I'm still paying both time and dime back and forth on the corrections with OASIS.
Sherry, thank you. I couldn't agree more. We spend a lot of time on education, and I don't want to ever underscore education. Education is so important, and we need to understand the nuances and the difference in the regulations. But, it's kind of like doing the same thing over and over again and expecting a different result. And when I think of accountability and leadership, I kind of go back to what we do with our patients every day. We don't expect our patients to make changes in their lives by just telling them about their health conditions or telling them about, you know, how their diabetes impacts their activity. We help them create a culture of accountability. That's what makes health behavior changes. It's no different in an organization. So we need to take all the great stuff we know how to do with our patients and apply it to leading our clinicians and leading our teams through change. So we need to create this accountability. And there's some really easy things you can do to create accountability. And it starts with you. So first and foremost, you can't hold other people accountable. You have to start by modeling accountability in what you do every day, and then guiding and helping people to incorporate accountability in their own lives. So think about that, how we do that with our patients. Think about how we model good behaviors with our patients and how patients put ways to check in and model good behavior for themselves. We need to do the same things with our clinicians. So think about how you approach education and how you approach the OASIS and how you approach regulatory changes. In the last week, have you said dread about new regulations or here comes Medicare again or thrown it with a negative spin? Those things all tell your team something. And then we expect your team to embrace it and understand the change and go into education with a positive response. Cindy, you just said when we were talking, when it's mandatory training, I'm just hoping that they don't hate it because it's mandatory
That is
training.
true.
That's part of our problem in our organizations. How do you create accountable worlds and create accountable cultures when we start with a negative approach to things? So first of all, and first and foremost, think about the changes at hand and how do you talk about them? How do you portray them? How do you create that accountability?
Well,
So
I think that's interesting, Tanya, because I think a lot of people assume, especially if we're going to talk about leadership and accountability, that it is I am going to make other people be accountable. And I think that's kind of what that word has gotten morphed into in the common understanding, is that I'm going to make other people do this as though it's some sort of negative, overlord type behavior. But I think as leaders, when it comes to OASIS, I see a lot of, unless I'm, at the review level or the clinician level or the educator level, leaders above that disconnect themselves from OASIS. That's not the thing. I have people, as it were, that are going to go take care of this for me. But then I'm going to sit in a meeting and wring my hands about our stars ratings, or I'm going to wring my hands about value-based purchasing, and are we ready for that? And OASIS has such an impact on those things that to say that I have no role other than to be upset if I don't like what our results are, that seems to fit with what you're saying. Is not that senior leaders are immersed in the OASIS guidance manual, but to say that's not my job, you go do it, may be part of the problem, and that disconnect between the leadership level and the frontline clinician about the value of this information.
So Cindy, you're absolutely right, and give a great example of how you create that accountable culture with using the OASIS change coming along. You first and foremost need to state your current reality without emotion attached. And that's really hard. And this is, again, where leaders start to go down that path of creating a culture where people throw their hands up. You state your current reality. OASIS is coming in January. It's not a negative, it's not a positive, it just is. Now, from there, once you have that current reality, you need to set action because you're not the victim of the change. It's not something you can blame for everything going wrong or for, lack of time. It's just your current reality. We have a new change. And you really need to think about your language and your words when you're creating a culture of accountability because it's how you approach what you're doing that matters so much. From there, then you start saying, well, we have an OASIS change. Here's the actions we need to take. We all need to learn that. And you're absolutely right, Cindy. We all need to learn that. When is the last time leaders of an organization all sat down and watched the same OASIS training? Can they actually converse with their clinicians about the changes and how it impacts how they engage with the with the clients in the home, with the patients in the home? That really matters. Like you saying, you know what, I'm going to learn this and I'm going to take action and know this. And then to be able to have conversations with your team about that creates that level of, hey, I'm accountable to this new change too. So drive out just a little bit of time to do that. Sherry, you have a thought there?
Yeah, I do. We're talking a lot about management down leadership, and I wanted to maybe bring up the subject because we probably have some frontline staff that are listening to this, and talk to them a little bit about how they have to lead themselves. And when I mean that, I mean that they need to also start preparing for these changes in a meaningful way. There is some free education that's out there. There are some resources all over the place. Heck, the manual is very easily searched. Just start reading it and prepare yourself to come to that educational whatever your agency decides to do to present this to everyone. Prepare yourselves in a meaningful way to engage in a conversation and maybe have that be the basic stuff, but be able to talk about other innovations that might help yourself on a day-to-day basis. If we could dialogue a little bit about that, I appreciate.
Sure. So that goes back to mindset and that creating that culture of accountability within yourself. Again, you cannot hold someone else accountable. So you can't hold your peers accountable and you can't hold your supervisor accountable and all vice versa. So putting any energy into, well, the nurse didn't learn this and the nurse didn't do it right, or the PT did this wrong, or all that blaming and finger pointing that unfortunately happens within organizations breaks down that level of accountability. So starting with yourself and saying, I know this change is coming and I have actions that I can do to change, to learn this change and move forward within that. Changes your own mindset because it puts you in control. And we all feel better when we feel that we are in control. So
Well, and
make sure you change that.
but I
Sorry,
think,
Cindy, go ahead.
Tanya, I'm sorry I interrupted you. I get excited on these things. I just asked Sherry. My issue has always been that there has been a top-down approach to the OASIS, and accountability again being a top-down perception. And K&K has said for years that the driver of accurate OASIS data collection is the clinician. I mean, the clinician is the one in the home, the clinician is the one seeing the patient, the clinician is the one making decisions. And so when they are feeling powerless, like this is always happening to me, and I have to do this and I have to fix it, and then the mean people in the office tell me when I'm wrong, that kind of that messes the whole thing up, as opposed to I am in charge of this. I am out there with the patient. I am responsible for accurate OASIS data collection in a positive way. I'm the one who's going to represent our patient to CMS utilizing this tool. And to do that, I want to make sure I do the best possible job. And that's where I see a lot of when you repeated what I said earlier about hoping it's not negative. That's what I see so many clinicians just look like, just tell me what you want then. What answer do you want then? And accountability isn't necessarily, a negative issue. It is understanding your role in this process, your opportunity, your chance, as it shows in our graphic here, to say, I can step up differently with E. I can utilize tools and resources. I can read the guidance manual. I don't have to wait for somebody to tell me. And if I'm not sure what answer to pick, I can look it up just like anybody else and use the official guidance to choose the right answer the first time. And then the downstream of, I don't want to get it back, I don't want corrections, I don't want to hear from, it wouldn't happen if I actually owned my role in this process.
100%. And from the upper management down, we need to also make sure that we're embracing the new technologies that have been discovered during the pandemic and using our educational resources that we can provide in ways other than having the entire staff show up at a certain time at the office. Embracing and respecting the time of your staff and understanding that they have demands outside of their job, and that having a flexible way that meets with the times of technology can also assist in how that information is received.
Cindy, when you were talking there, I was smiling because you were role playing so wonderfully, stating your reality and then stating your actions. You don't want to become a victim. And nobody likes to not have control and be in that victim mode and blame mode. And that's what happens when you have that culture that lacks accountability. So just like Cindy stated, I know OASIS is coming. That is your reality. It doesn't have any emotions attached to it. And from that, what are the things I can do? It doesn't matter what my company is going to do. It doesn't matter if maybe my company rolls out education later than I think they should, or they don't roll it out in a fashion that I would like. What are the things I own that I can do? And Cindy just gave you a whole list of great things you can do on your own to learn about this and control that environment. That's how you model accountability. And when you start modeling it for your peers, and modeling it for each other, it becomes contagious because people see your positive outcomes from it. So just think about the next time you use your words. And are you walking into that victim mentality, or are you owning that reality, and are you doing something about it?
Thank you, Tanya, and thank you, Cindy. Some great insights that folks can really some meat that people can use to make this change that again is happening. It's inevitable. Occur in a way with the least amount of conflict as possible. However, there is always conflict with change, and sometimes that conflict is just your own fear of what's coming. Sometimes that conflict is just the frustration of another regulation, especially in home health, where we feel a little bit overburdened with the regulation. So that leads us into our second podcast. This is the first of four, and our second one is going to be on conflict resolution, and some tidbits on how to manage conflict resolution after or during a process of change. If you need any more information from the folks that are providing this podcast today, feel free to go to www.valuebeyondthevisit.com for OASIS e-education resources. And if you need leadership resources, please feel free to reach Tanya Miller at, what is your website, Tanya?
Sorry, tymcoaching.com.
tymcoaching.com. A great resource for anybody out there. Thank you for listening to podcast 1, and we'll be back with you soon.